My topic is Bartollotti syndrome. Congenitally, there are something called as Hox genes. One of the theories behind this Bartollotti syndrome is that Hox genes cause little bit of problems in the differentiation, and a small sacrum will need more support to it to dissipate force which is coming from above, right inside the womb. It will incorporate the last L5 vertebrae. It is called as sacralization.
So when we look at lumbarization example, this is the sixth vertebrae. How is the sixth vertebrae? 1, 2, 3, 4, 5 and 6. There is no L6. It is the S1 of the sacrum which has been left because maybe it's a longer segment, so it didn't want it. Inside the embryonic stage only, the L6 vertebra is formed. This causes a lot of confusion while doing surgery also.
These two are called transitional vertebrae. It's a congenital anomaly. Recently I got a patient when I was seeing her back pain scenario, saying that it's a Bartollotti syndrome. Don't worry, it is described more than 100 years ago, 1917, by an Italian physician, Bartollotti. I said it is a congenital problem which you got. Then she said, doctor, I have only one kidney. Just for something else we did an ultrasound and they said I have only one kidney by birth. So that is a very important point. Because I want to tell you, if you have a Bartollotti syndrome, most of the cases they are asymptomatic. There are no symptoms, but some give a lot of problem. They can mimic sciatica by entrapment of the exiting nerve roots which form the sciatic nerve and cause claudication, paresthesias, numbness. The radiologists, they just mention sometimes sacralization present, nothing else. How much? Both sides are seeing one side, whether there is any kind of a pseudoarthrosis, whether there are changes in the sacroiliac joint. They don't give more information about it. So I wish to appeal to all the radiologists to please, in fact, if you find a sacralization or lumbarization, maybe a spina bifida is there, maybe a spondylolisthesis is there, a lysis is there. The pars is never mentioned. Here in this research which I did for the article, I found that the pars interarticularis is smaller. Even if you clearly observe that posterior spinous process is not normal compared to the one above, it is also smaller. So when there is so much of congenital problem occurring in that local area, definitely there will be some problems with stability, and if it's unstable, it can create a lot of problems.
This patient has attenuated lamina. The lamina are not as thick as that above. They're thin. The spinous process is also very thin, and there is a abnormality at this point. See, you have the full the facet here. Facet is defective. It shows as if there's a gutter-like opening. So they are all congenital problems which are there present in it.
So is it not our responsibility to mention it properly so that the patient can be forewarned? Why? If they go to the gym and do a deadlift, they just bend down and lift weight. The sacrum and the L5 are acting like one, whereas the L4 is the only last mobile. It's not L5S1. So L4 has to compensate, take on the work which is done by L5. Normally L5S1 is more mobile, leaving us with all these movements, happy movements. Now when it is fixed on one side or both sides, either pseudoarthrosis or a complete union, so this becomes stressed. That is why the one above gets more involved into herniations, protrusions and other things. The one at the level of the transitional vertebra, although it shows L5S1 as narrowed, please do not call it as degenerative disc disease. No, transitional disc, that is also normal disc, normal to that transitional condition. It's also genetically oriented. So we should say it is a transitional disc that can also degenerate. So there's a lot of difference when we speak about a disc which is normal and degenerating due to overstress, or a transitional disc degenerating due to other reasons. I wish to show you some bits of flexion extension that occurs at the facet joints, the ligaments that are involved, posterior spinous ligament, facet capsule, how much they stress. Almost 60% they can stretch. Now I'm going to come to one more video which I want to show you. a person in an amusement park, we all went and we are seeing, he does this curve, that curve, he jumps and all that, and and then he turns, and when he turns, he's so flexible. I compare it to a normal spine. We all are very flexible. We bend, we do this, we can have extension, we jump, we extend, we play basketball. Transmits weight even during sleep, remember, spine. Now, once something happens, like for example, if you are doing a heavy work, still you can do, you are flexible. But then there is a little, see, if you do like this, it's okay. But as you come closer, if the joints are coming closer and they are doing like this, when you do like this, don't you feel warmth? There is friction. If the normal synovial joint is having nice lining of synovial membrane and the synovial fluid, and it's not arthritic, young bones, they will take it. But there is some heat generated. There is some kind of a friction generated. This, when I see this video, I will say there is some smoke. You see this? There will be some smoke coming from the tires because he is putting his brakes and he's flexible, but it's a normal way of a stunt driving. Now, what he does, he goes to straight and brakes, pulls both the brakes and revs, brr, 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 and you just watch the tires. So much of smoke is coming out. Means the friction has increased like anything. That brings damage. He just does it for 5-10 seconds and goes off. But if he does it continuously, the tire will heat up and even burst. What I mentioned in the Open Journal of Orthopedics publication in January is Kiran Nandivada's stuck blade in a grinder jar, degenerative cascade by LSTV at L5S1. LSTV is lumbosacral transitional vertebrae. What is a stuck blade? Now just go to another example. You have a grinder juice maker. When you press, brrr, it goes. Suppose if it is bent or stuck, but still you press, the heat increases inside and the motor may just burn off, or it may even destroy the other parts, bearings of the grinder. This is exactly what I would like to picturize here. Now what happens is the pelvis does rotate. The pelvis has nutation, counter nutation, little rotations, and these movements are affected. So it leads to arthritis of the SI joints, sacroiliac joints. Similarly, the rotations and flexion and little extension, these movements that occur minimally at the facet joints are also impeded. Sometimes it leads to degenerative arthritis. So don't think Bartollotti syndrome is a small passing diagnosis. It is a very serious diagnosis which all of us have to give importance to. Rest, more details are there in my paper. I'm giving you the paper DOI. Okay, please go through it. And all orthopedic surgeons, especially the younger ones, don't miss this diagnosis. When you find this diagnosis, explain to the patient that they have to lose weight. If you lose weight, most of the dynamics, degenerative dynamics, can be controlled to some extent. Yes, physiotherapy, yes. Radio frequency ablation, yes. There's so many excision of this transverse transverse process. Yes.
Yeah. You're 32 years. Yes. And you have do you have any objection for all the work I'm doing, academic work, documentation?
No, that's fine.
I'm an educator on the YouTube and other places. You don't have any issue showing you, right?
Everyone should know about it.
Exactly. I'm very appreciative. Really, thanks a lot. Correct? Now you were operated, you said. How many years ago?
2016.
For the L4, L5 disc?
Yeah.
Yes. So what happened? What was the reason? You had back pain and leg pain, or only back pain?
No, not the leg pain, but I continued to have the back pain. And
now the present situation, 2016 you were operated. Now 4 plus 3, 7 years has passed, and she is having narrowing of the disc space, which I am not sure whether this narrowing was present even before the surgery. But then 7 years, 32 minus 7 is 25 years. At 25 years, she underwent a surgery, which is quite early for a disc herniation to occur. Well, it occurred. Now what happened? Like I said, there is a disc space narrowing. If it is present before surgery,
I cannot say. But if it is present now or developing now, I will call it post-discectomy. Once you remove the disc, post-discectomy syndrome, because the disc has been removed and there is a loss of support for the two vertebrae. Spinal motion segment has lost its support. It is landing in narrowing of the disc space, like it is. See this is how it is. Once there is no support, my finger is the disc, I remove the disc, it goes down and then causes again pressure on the nerves and causes the dermatomal, sensory, motor or functional even activities of daily life will be restricted. Today she came with severe pain. There is a mega, means big, apophysis transverse process by congenital origin and is usually due to Hox genes. This is on both sides. Castelvi has classified it, and it is now resting on both the sacrum, ala of the sacrum, causing it to decrease in its movement. So now I give an example. Now this is not going to move once it is fixed on both sides. So what happens? Let's visualize an office where one colleague has to go to his home country. Other colleague is requested, can you please do my duty for 1 month? He'll say, okay, you go. But when he goes, suppose he cannot come back. It happened in COVID. Airports were closed, visas were cancelled, nobody could come back to their duties. The person on duty will have to do 2 people's duty. And then one day he will give up because his health will start failing. He will go to the boss and say, sir, I'm resigning, or give me one more help, at least temporary help. Although I like my friend who is on leave, I cannot do 2 people's duty. So that is what is happening at L4. When L5 is not working, this is a progressive degeneration going to occur at L4. So L4, L5 disc starts degenerating. Also, the load dissipation along the sacrum, meaning sacroiliac joints, which is normal, gets disrupted, and the sacroiliac joints, you observe, they are becoming white. You're understanding now what I'm trying to say? These are sacroiliac joints. These are also getting white, isn't it? Meaning they are getting overloaded and becoming little degenerative because of this segment getting fixed to the sacrum. That is the cause of pain. Okay. Now can I ask you, was this explained to you by anybody till now? No. So this is what I'm trying to highlight. Please, my friends, there is no ego in learning and rectifying and updating our knowledge. This is Bartollotti syndrome. And she is just 32. Already at 25 years, she got a spinal surgery done. Now again, she comes back with severe pain. Low back only. No radiating sciatica. So with this, I would like to give her physiotherapy, and maybe after physiotherapy, if she doesn't recover, I will go for MRI scan to see what's happening, because I saw a little calcified soft tissue inside the spinal canal, which I'm not at all comfortable with. So this is what I would like to highlight to the radiologists as well as orthopedic surgeons. And madam, thank you so much for coming forward in helping me educate the other doctors. Thank you.
Thank you so much.
Thank you so much. Going back to the same patient's x-ray, I do always pending x-rays. This is also a request to all orthopedic surgeons. Whenever backache patient comes, it's better not to miss than be sorry. Somehow I feel alpha S1, there is a lysis. There is a lysis and also a small grade 1 lysis. This is a backward bending or normal? This is a backward bending x-ray. So let's see the normal and the forward bending. This is a normal lateral view, and here what do I find? Still this little 1 mm or 2 mm grade 1 lysis, I still say it is lysis. See, there is always a scope for debate and contradiction, which I welcome. The forward bending. So if there is more movement, I would say that it is unstable. So even if there is a little suspicion, initially also I suspected that this lamina and this posterior neural arch is little thinned out here compared to this. Compared to this, it is thinned out, definitely thinned out. It's like a small neck, narrow neck. So with this, namaste. I will catch you all again with another topic shortly. Bye-bye.